Hello everyone, this is Argueta and I would like to welcome you to this clinical case presentation. This lecture is related to the Saving the Natural Tooth clinical cases contest that Meta Biomed launched internationally in this 2020. I would like to express my gratitude to the company because they are offering this space for us. When it comes to decide on saving or extracting a natural tooth, we might face a difficult situation because there are many factors that are related to the prognosis. We need to analyze the diagnosis, the periodontal stage of the patient, the etiological factors of the disease, and for sure we also need to have in mind since the beginning of the treatment the final restoration to keep that tooth in function. The clinical case that we faced in our office was this one. The patient asked us do our best to save the tooth. And the first thing that we have to do is to establish a diagnosis. The tooth was not responding to the sensibility tests. We might see that the periodontal tissues are in a normal condition, and we decided to isolate the tooth and to remove all the caries that is affecting this tooth. It is very affected and we need to remove that caries to have a better understanding of the stage of the tooth. One of the first things that we need to understand is that proper isolation will allow us to maintain that treatment and that tooth free of contamination. Most of clinicians around the world are used to place a clamp, to use a rubber dam, but I like to add a flowable dam all around the clamp and all around the tooth. In this case, I like to use NextStemp LC. NextStemp LC is a flowable dam that have a good attachment to the clamp and a good adhesion to the enamel of the tooth. In this way, the material will stay in place during the complete treatment, offering a proper isolation. And actually is a material that have different applications during the endodontic procedure, and we will see some of the advantages during the presentation. The first thing that we did here was to start removing caries, but as soon as we noticed that there were no pulp chamber at all, that the pulp chamber was full of calcifications and that we need to preserve all the healthy tissue in that tooth, we decided to change from the high-speed burr to a diamond ultrasonic tip. With the ultrasonic tip, we can be more conservative and we can take care of that healthy structure that we want to maintain. And we need to analyze how our procedures may affect the stiffness of the tooth. And this study published by Ree in 1989 is a classic study where he demonstrated that the shaping of the root canals have no significant effect on the stiffness of the tooth. The access preparation neither, but the loss of marginal ridges and the loss of walls on the tooth will affect in a big manner the stiffness. So we need to preserve that healthy structure that is remaining on the tooth. So having in mind the anatomy of that upper first molar, we started removing the tertiary dentin that was formed at the pulp chamber, trying to look for the entrances of the root canal system. In this video, you can see that we were able to locate first the entrance to the palatal canal, and then we were able to locate the mesiobuccal canal. In this type of tooth, it's kind of difficult to locate the entrances of the root canal because we lose all the anatomical landmarks due to the severely destruction that was present in that molar. After locating these two canals, they can act as a guide for us for continuing looking for the distal buccal canal, and this is what we did. It's important to analyze all the colors, all the calcifications that we can see at the pulp chamber, and as you can see we have here this dark area that corresponds to the floor of the pulp chamber. This yellowish area corresponds to the calcification of the tertiary dentin that was formed at the pulp chamber due to the external stimuli that was affecting the tooth for a long time. And one clinical tip that have helped me a lot and I will share with you today is to place some sodium hypochlorite in the area of interest. The sodium hypochlorite will hydrate the tissues in that area and will offer to us a better understanding of the area to treat. As you can see now, it's more evident that we have in this area, the floor of the pulp chamber, we have in this whiter spot one calcification that might be covering the entrance of the distal buccal canal, and this yellowish calcification in this area have to be removed. We also have some remaining caries here. These caries have to be removed as well to have at the end all healthy structure. It's important to locate all the canals because one of the most reported causes of failure in the treatments related to the endodontic field is the persistence of bacteria, and that persistence of bacteria might be related to non-treated canals, and we need to pay all our attention to locate that canals. In this case, we were able to locate the three principal canals. We were able to go inside, and with some effort we managed to enlarge and to shape the canals, but we need to look for that MB2 that is reported that is present in more than 90% of the cases. This is the situation after enlarging the entrances of the buccal and the palatal canals, and one advice is do not to enlarge the entrances of the root canals before removing the calcifications. I made this mistake in this treatment, but I risk to push some calcifications inside of the root canals, and we do not want that because it might compromise our treatment. So it's advisable just to locate the entrances of the root canals, remove all the calcifications, and then start enlarging the canals. At this stage, we continue removing the calcifications located at the pulp chamber, and we started looking for the MB2. The MB2 in most of cases is located from 3 to 5 millimeters away from the mesiobuccal canal in a palatal direction, and we need to look in a line that is parallel to the mesial wall of the root. So we started removing this tertiary dentin at this area from 3 to 5 millimeters away from the MB2, and we finish with the removing of this calcification in this area. As you can see now, after removing some dentin, we might have some idea of where the MB2 might be located. We still having calcifications here, but these calcifications are strongly attached to the pulp chamber floor, and they are not going to interfere in our root canal treatment, so we can just leave the calcifications. Now that we were able to locate the main canals, we were able to locate the possible location of the MB2. We proceed to medicate the canals, placing some calcium hydroxide. We like to use Meta paste. Meta paste will help us to protect the entrances of the root canal. It will work as a physical barrier, and it will work as an intracanal medication, because this is the point in what we need to perform our pre-endodontic core build-up. The pre-endodontic core build-up is an step that we need to do in every root canal treatment because it have many advantages and it can be used as a useful reconstruction for the final restoration. So after placing the calcium hydroxide, we proceed to protect the pulp chamber. We use again next stem LC because it is very easy to see and is easy to remove and will avoid the restorative material to go inside of the root canal entrances. So we decided to proceed with our adhesive protocol. We use Easy Fill, that is a nano hybrid composite from Meta Biomed as well, and we reconstruct the walls that were missing in that tooth. And as you can see, this protection of the pulp chamber will serve us as a guide to go inside again and to remove it, and we will have regular endodontic access opening that will give us access to the root canal system. Among the advantages of the pre-endodontic build up, we can mention it will keep the irrigant in place. It's very important to have the pulp chamber full of irrigant all the time. It will provide a better distribution of the forces that the clamp will generate on the tooth, and it will decrease the risk of fracture during the appointment. It will also prevent inter and intra appointment contamination because we will have a proper isolation and we will be able to clean as good as we can inside of the root canal system. The pre-endodontic core build-up will provide stability to the temporary restoration, and one of the most important factors is that it will maintain the gingival health because we will be able to restore the contact points and we will avoid the food impaction in that area. It will provide us also a cleaner operative field and we will be able to work much more comfortable. Just for showing you how big can be the damage that the food impaction can provoke in the gingival tissues, I will show you this case. As you can see, we have an interproximal caries here. Clinically, it does not look so big, but in the radiograph, you can see there is a big caries. So we decided to remove the caries. We decided to assess in what condition the tooth was, and we were able to proceed with the pre-endodontic core build-up. As you can see, our adaptation at the cervical margin is very good. We were able to recreate the contact point in this area, but sadly, the patient already have some bone loss in this crestal area. As you can see, we have a loss of approximately 4 to 5 millimeters of bone in that area just because of food impaction. If we do not do the pre-endodontic core build-up, the patient may have persistent pain, and that pain is not going to be related to the endodontic treatment. It's going to be related to gingival factors, and we can avoid that problem in the post-operative stage. Now we have two complete different scenarios. This is the first picture that we take, and this is the picture we took after the pre-endodontic core build-up. As you can see, everything looks cleaner, everything looks healthier, and everything looks much more comfortable to work in. It's very easy to see that we have the 3 entrances of the main canals. We can see where the MB2 might be located. So we proceed to enlarge, to shape, and to clean the MB2. For doing this, I use the Aurum Blue system. Aurum Blue is a file system by Meta Biomed as well. These files are in a martensitic stage. It's possible to prevent them for going easily inside of the root canals. And as you can see, the efficiency of the files for shaping even in constricted canals is very good. So we were able to clean and shape the MB2, and this is the picture after the process of cleaning and shaping. And now we are ready to proceed with the next step.